heart disease affects millions in the United States. So what can you do to lower your risk? Dr. Roland Reyna with Health Texas Medical Group of San Antonio is here to give us some advice. Doctor, thanks so much for joining us.
Thank you very much. I feel like I'm at a Hannah Montana.
Yeah.
Great process.
Now we just need the crowd cheering for us really loud. Well, thanks for being here. You know, heart disease is one of the #1 killers in the U.S. That's why it's so important to talk about. We want to let y'all at home know that we're speaking right now with one of the big experts in cardiology. You've actually been received the honor of Best Doctors in America, right?
Yes, I have, for the past 14 years.
Wow, what an honor. And also Master of Cardiology.
Master of the American Academy of Cardiology. We've got 14 of our doctors, actually 80% of our doctors have been chosen as best doctors in America as well. So we've got a very nice medical group as well.
What an honor. Let's go into the risk factors.
Yes.
What are some of the risk factors when looking at heart disease?
You know, there are things that you can control and the things that you can't control.
Okay.
The things that you can't control are being a man, being over 50, and having a family history of early heart disease. So anybody in your family, mother, father, brother, sister, first-degree relative, who has a heart attack or stroke before the age of 60, that's a major risk factor.
That's a major, and then maybe, what if it's like your grandfather? Does it lessen the risk by about 50%?
It lessens the risk.
It does lessen it?
But it's a first-degree relative is the most important.
Okay.
But, you know, if everybody in your family kind of dies off early, cousins, uncles, you know, you need to pay attention to that.
Definitely. And then let's talk about the ones that are actually controllable, because that's something that hopefully we can change our lifestyles to be more healthy.
Yeah. You know, even though the United States has spent so much money on healthcare, and we think of our country having the best healthcare system in the world, we don't really do a very good job. And it's really because of the controllable things. Being overweight, having high blood pressure. The great majority of people who have high blood pressure don't even treat it properly. And sometimes, unfortunately, as doctors, we don't do a good job of doing it as well. Smoking is terrible. Smoking is like a cancer. It will double, triple, quadruple your risk of having heart disease, particularly of the other risk factors as well.
Wow. Let's get into what your doctor can do.
You know, in terms of your doctor, I think it's important that the patient, the person, know what the risk factors are, and they do something about it to where they can address it.
And they can bring it to the attention of their doctor.
That's correct, yeah. It's important to bring the blood pressure down.
Okay.
Patients should get involved in this. They need to know what a normal blood pressure is.
What is a normal blood pressure?
A normal blood pressure, abnormal is over 140 and over 90.
Okay.
But really, the lower the better.
All right.
If there's a family history of heart disease, you need to know your bad cholesterol needs to be under 100. There's a good cholesterol, I like to call that the happy cholesterol.
Yeah.
That's the HDL.
H for happy, that's easy to remember.
And then the LDL is a low down lousy.
Low down lousy.
And that needs to be under 100.
Okay.
Yeah. And if you have heart disease, even better to have that even lower, even under 70.
And so if your doctor knows about these things, they can regulate your LDL with medicine, right?
That's correct, yeah.
And then changing lifestyle habits as well, or suggesting that.
Yeah.
And then controlling diabetes, right?
Oh my God. You know, unfortunately, 1 in every 4 Hispanic adults in this country has diabetes.
Wow.
So diabetes, especially in San Antonio, is a major problem. So it's critical. Not only can you control diabetes, but if you lose enough weight, the diabetes can go away.
And I want to say too, actually, my father had a heart attack within the last year, and he went to doctor's checkups and everything, and they never screened for heart problems, and he looked healthy on the outside. So there's a lot of things that, you know, we need to take into our own hands, and what are things that we can do and sometimes bring to the attention of the doctors?
Many times, just losing 10 or 15 pounds makes a big difference.
Okay.
Diabetes can go away. It can come under control. We can monitor our own blood pressures. We can go to H-E-B, Walmart, and write the blood pressure down, take them into your doctor, and let them know what the blood pressure is. Studies have shown that doctors only control the blood pressure about 40-50% of the time. So many times you might go in with a little blood pressure of, let's say, 150 over 90, and they say, well, it's okay. It's not okay. It really is important to bring it down.
That's a really good point, and that's something that's important to regulate ourselves, as you said, because sometimes on the outside we don't look like, even if you don't smoke, if you are at a healthy weight, if you exercise, on the outside sometimes it looks like a perfect picture of perfect health, but sometimes it's not on the inside.
I think it's important that we do these things, because otherwise we'll end up like an exhibit, like we'll be seeing in just a couple minutes. Yeah.
Isn't that true? All right, and then there's some unique issues to San Antonio. We kind of touched on that with the Hispanic adults that have diabetes.
Yeah.
And, you know, Anything else on that specifically to our region?
You know, unfortunately in San Antonio, as I said before, 1 in every 4 Hispanic adults have diabetes. The other thing about San Antonio that's unique, it's one of America's fattest cities. You know, I think it was number 2 and 3 here recently after Houston and New Orleans, and that's terrible. And it really has a lot to do with our culture, our diet, our lack of exercise. So there are incredible things we can do that would help.
Well, thank you so much, Dr. Reyna, for being here. And we want to let you know it's never too late to start keeping yourself healthy. Health Texas Medical Group of San Antonio. For more information, call them at 731-4864 or visit them on the web, healthtexas.org. And also, you guys are going to be back in the future, so we look forward to future segments.
Thank you.
All right. Well,